Tuberculosis has existed for centuries, and one of the biggest challenges doctors have always faced is detecting the disease early enough. For a long time, TB diagnosis relied on traditional methods that sometimes took days or even weeks to confirm the infection. And during that time, patients could unknowingly continue spreading the disease to others. But today, advances in medical technology are transforming how tuberculosis is diagnosed. Modern diagnostic tools can detect TB faster, more accurately, and in some cases within just a few hours. In today's World TB Day, we are going to talk about how technology is changing TB diagnosis, how these tests work, and why early detection is critical in controlling the spread of tuberculosis. Joining us for this conversation is Dr. Davinder Kundra, Head of Unit Department of Pulmonology at Manipal Hospital Dwarka, who has extensive experience treating respiratory diseases. Thank you, Doctor, for joining us out of your busiest schedule.
Most welcome. It's a pleasure to talk about TB on this World TB Day, which is just around the corner.
Yeah.
So let's start with TB. As you said that it has been in the very discussion for over more than 100 years. So I tell you a little bit of history about that. It was diagnosed by a German bacteriologist Mr. Robert Koch in 1882. This bacilli, this Mycobacterium tuberculosis bacilli, Koch's bacilli, it was first diagnosed in 1882. Since then, it has been in a discussion in medical fraternity because it was really a prevailing disease at that time, and still it is quite prevalent in all over the world, not only in developing countries but also in the developed countries as well. So in our country like India and developing country, the scenario is changing day by day. The prevalence is increasing, incidences are increasing. But after coming to effect, this tuberculosis control program, the target is to end TB. Now we can say that incidences as well as prevalence, looking like under control, but not that much control, which target really was. So let's talk about how it was diagnosed in the year 1882. First was the microscopy. The sputum smear was done initially to find out this bacilli, this bacteria of tuberculosis. So it was the first test which remained into effect for almost 20 to 30 years. After that, the scenario changed. The culture came into effect. Sputum culture was done to find out is it TB bacteria or not. It showed bacteria, so the diagnosis was more consolidated and a better diagnosis was provided at that time. But since then, this culture has been the gold standard way of diagnosing this tuberculosis bacteria till today. So it hasn't changed as yet. Microscopy as well as culture of this bacteria in the sputum, if I'm talking about the pulmonary tuberculosis, as well as TB of other organs affected. So taking sample from those organs or those tissues and showing the culture which is growing in Mycobacterium tuberculosis, it has been the gold standard technique of diagnosing TB.
And how long did these tests usually take?
In every patient, though it was done, 100 years back, but still it is being continued. First step is microscopy, the sputum microscopy for acid fast bacilli stain to see is it positive or not. When I'm talking to you, to my audience, I would like to say that I'm focusing more on the pulmonary tuberculosis, but I tell you TB can affect from skin to bone.
Okay.
But most of the cases are pulmonary tuberculosis. Rest of the case, like say, I make it very simpler for you. 70 to 80% patients are of pulmonary tuberculosis, and 10 to 20% are extrapulmonary tuberculosis. But many a times, people who have extrapulmonary tuberculosis, they have involvement of lungs as well.
Okay.
It has been seen many a times. So, you know what? So, if I'm just focusing on the pulmonary tuberculosis first, as it is more common in the society as compared to the extrapulmonary tuberculosis. So these tests, like I said, the microscopy of the sputum to find out the acid-fast bacilli stain, followed by this culture technique using the solid medium or liquid medium. So it was diagnosed on the basis of the culture as well, which is still a gold standard technique. Later on came into effect RT-PCR technique, real-time polymerase chain reaction technique. And after that, over a few years, many techniques were in the pipelines, which came into effect. And finally, in like around 2010, Gene Expert, which is now the most common molecular diagnostic testing for tuberculosis, a rapid molecular diagnostic testing for diagnosing tuberculosis. Gene Expert, and in fact, before Gene Expert, there was one more test. It was a line probe assay test.
Okay.
Still used. It is also a molecular test. As you know, these molecular tests are, they give result quicker than the conventional one.
Okay.
I'll come to why these are different. So first, once we are talking about the molecular test, these are Gene Expert, then line probe assay test, and a few more tests which we sometimes use, like clamp test, which we use. It is a loop kind of isothermal amplification test. So basically, nowadays we use Gene Expert.
Okay.
It's a cartridge-based nucleic acid amplification test, and followed by line probe assay test. These are the molecular tests which we use. After that, now we have a gene sequencing test, the genomic sequencing test, in which we target genomic sequencing or whole genome sequencing is done to find out that the T bacteria and which characterize the bacteria. Now, the benefit of having these molecular tests is they, as I said, the rapid test. These rapid tests provide diagnosis earlier, so we can start the treatment on time. Also, these tests provide the information whether the TB bacteria is resistant or sensitive. Means if is it multi-drug resistant TB or a sensitive TB, drug sensitive TB. Though again, I tell you, most of the cases are drug sensitive cases. But these tests quickly provide us information about whether this patient is having multi-drug resistant TB or not. Because if it is multi-drug resistant TB, I'm going to start the treatment for multi-drug resistant TB, not the drug sensitive TB. And the treatment of both of them are totally different. Even the duration of treatment is different. The cost of treatment is different. And the complication related to the treatment is different for both in both the cases. And as I said, the sequencing, the genomic sequencing, which is more available in the developed countries, not in the developing countries, because of the source limitation here. Though it is also a good one, which provide better result, accurate result, quicker result. But in country like us, developing countries, we are using molecular tests like Gene Expert and line probe assay test.
Totally.
As both of them provide us diagnosis early on time, and we can make a decision to treat the TB in which direction we should move ahead.
And sir, how accurate are these modern tests compared to the old methods?
See, as I said, the conventional, this culture medium, it has been the gold standard technique. Though molecular tests are available, these are quite accurate. I tell you, the sensitivity is quite high and the specificity is almost 99%. But if I talk about the microscopy of the sputum, which was started in late in 1882,
the traditional one,
a traditional one, sensitivity was quite low. It was like 40 to 60%. In immunocompromised patients and in children, the sensitivity was just 20 to 40%. Culture has more sensitivity, say around 80%, and the specificity is absolutely 99 to 100%. And if you talk about the molecular test, the sensitivity is quite high, almost 90% sensitivity, and the specificity means of detecting the true negative ones are like 99%. These tests, as make the diagnosis faster and help physician to take the decision in which direction to move to treat the TB, in a direction of drug sensitive TB or in a multi-drug resistant TB, or even some other form of the TB like extended drug resistant TB or total drug resistant TB. So though these are very rare, extensive, and total drug resistant. MDR is now prevailing. Multi-drug resistant TB cases we are seeing. It's
Okay.
often now.
And what were the biggest limitations of the traditional TB diagnosis back then?
The limitation was like this microscopy of sputum. It requires that experience of the technician. Though it is the result is available in 24 hours.
Hmm.
Microscopy of the it is positive, yeah, but it cannot characterize the TB. It cannot
Okay.
whether it is drug sensitive or drug resistant because it has shown the biopsy first bacilli. Also, it may vary from observer. Like I'm talking about the technician or a doctor who is seeing making the slides. Whether there can be human error to diagnose it. That's why the sensitivity is low, but the specificity is quite high. Once it is positive on the microscopy, it means 100% specificity. It is TB, no doubt in that. But we cannot characterize on the
Hmm.
basis just sputum site that's staining. Culture tell us it has grown Mycobacterium tuberculosis. Actually, Mycobacterium tuberculosis is a complex. It is a complex, and in this group, Mycobacterium tuberculosis is one of the part. Along with that, there are some other Mycobacterium.
Hmm.
What happens? The culture shows is it a Mycobacterium tuberculosis or some other Mycobacterium or maybe non-Mycobacterial TB also. So that's why the culture has been the gold standard technique. On culture, we can do drug sensitivity testing, which
Hmm.
can reveal which drugs are effective in treating the TB.
Yes.
First drug which we use, isoniazid, rifampicin, ethambutol, paracetamide, are these effective or not, sensitive or not? That drug sensitivity test can tell. Along with that, other drugs can be tested on the same culture to find out are those drugs are effective or not.
Yes.
That's why culture is still the you know uh, gold standard technique, but it takes time for the result to come and to decide. We cannot wait for 6 weeks for a patient to start the treatment. Here, the role of molecular testing. Patient has come to me. Patient has some sputum production. I got microscopy done. Let's say it is negative, but when I got a gene expert test done,
Hmm.
it show has detected MTB, Mycobacterium tuberculosis.
Oh.
Result is available in 2 hours. If not in 2 hours, in most of the places within 24 hours you get the result. But actually the turnaround time is 2 hours or in fact less than 2 hours. Where we require more further testing like line probe assay, which provide resistance to some other first line drug like isoniazid.
Hmm.
So it may take from again few hours to 72 hours. In 3 days we get the result. So that's why molecular testing has been a really a good one,
Hmm.
to diagnose the TB and start the treatment immediately.
So, sir, you talked about a lot of modern diagnosis system. Nowadays, the technology is taking at the apex level an advanced step into it. So, is there any kind of integration of artificial intelligence as well into the diagnosis thing?
So it could be in the pipeline, but so far it hasn't been into effect. As AI may have in the role of detecting a TB, but I don't think so because the culture, as I said, it's a
Hmm.
gold standard. AI
Yeah.
cannot tell us. AI can help in like suppose we got imaging studies done, which
Yes.
can suspect it is going in favor of TB. But TB may present in any form. Even there not cannot be a single pattern involving or involvement of that particular organ. Let's say about the lungs, it is not a single pattern which is always indicative of TB. There may be multiple patterns. So again, diagnosis depend on the pathological specimen testing rather
Okay.
than just uploading that image and it's showing that TB. It could be TB. I'm not denying it, but it has to be proven.
Yeah.
If it is TB, we treat it. Otherwise, no need because otherwise, like it's going patient is going to take this treatment for at least 6 months. If it
Yes.
is, then it's a waste.
Yeah. So, if we talk about some of the importance of early diagnosis, because you have already talked about a lot of ways through which we can deduct it. So, let's start. How important is the importance of early diagnosis? You must be seeing a lot of cases every day. So, why detecting the TB in early stage is important for not only the patient but for the others as well?
Early detection is very helpful. I tell you why. Because once we detect early, we can stop the transmission to another,
Yes.
control the disease at the source level, break the transmission to another one, and then prevent the protect the susceptible population from having TB,
Yeah.
like kids, like high risk group, older age people, immunocompromised patient who have cancer or HIV patient. I tell you, many HIV patients have TB co-infection, and many patients dying of TB have HIV infection.
Due to low
Many,
immunity?
yeah, because of low immunity. I tell you another scenario like a diabetes patient who has diabetes, and patient is having unexplained weight loss. Patient think that only because of the diabetes, but many times has been seen that patient has tuberculosis. It has been seen that symptoms arises not in every patient quickly. Like few patients have severe symptoms, few patients have
So,
mild
what are
symptoms.
the symptoms any patient
Like,
can see?
as I said, pulmonary TB and extrapulmonary TB. In the pulmonary TB, patient may have cough, the patient may have sputum or blood in sputum, which we say hemopsis. Patient may have weight loss. Patient may have intermittent fever or evening rise of temperature, and patient may have night sweats, fatigue. These are the symptoms. But if I talk about the respiratory tract, most of the patient have cough, sputum, hemopsis, chest pain, along with these symptoms, like I said, weight loss, fatigue, night sweats. But even patient who have a extrapulmonary TB, like say I said from skin to bone,
Bone.
I start lymph nodes in the neck. Patient may have cervical lymph nodes. Those lymph nodes, because of those lymph nodes, patient may have fever, patient may have weight loss, patient may have abdominal TB. There may be problem with abdomen. Patient may have pain abdomen or abdominal discomfort. Again, these patients have weight loss. Weight loss has been consistent in every patient whosoever has TB. In most of the patient, in majority, I would say. So symptom depend on which organ has been affected. Like a patient who has meningeal TB or brain TB may have fits, may have seizure, may have headache. Patient may have ophthalmology.
Yes.
Eye in the TB may have blurring of vision. Even
Oh.
patient may have skin TB may have different kind of rashes.
Mm-hmm.
Urinary TB. I tell you one very interesting thing. Female who have low fertility, who are not fertile. It has been seen in many of them has tuberculosis, and those were treated for tuberculosis, and later on they become fertile and conceive.
Oh. So it varies body by body and it
Yeah,
varies.
every organ is affected by TB. You
Oh,
from head to toe, skin to bone, TB can involve and can present in any form.
I totally get it, sir.
Now, the common presentation of this uncommon disease is more common than the uncommon presentation of
Yes,
this.
exactly. And sir, if someone has symptoms today, for example, so how quickly should they get tested for the TB?
The symptoms wise, I tell you, as I said, it happens that patient has only mild symptoms,
Hmm.
even for many months, 2 years. But once we investigate the patient, there might be some changes in the lab parameters. Or if I talk about the pulmonary TB on the X-ray, I can as a doctor we can find out those patches or those
Yes.
shows us creating suspicion of the patient is having tuberculosis. Then we proceed further and investigate. Similarly, if patient has unexplained weight loss, specifically here I want to emphasize on that. Anyone who has unexplained weight loss should be investigated.
Okay.
Is something going on? Is it TB or maybe it's not, but we should find out.
Yes.
Because in our country, I tell you one interesting thing that in our, if globally, WHO has declared that TB is a like it's very prevalent all over the world, and it's a global health hazard. And India is bearing a burden of high incidence, almost
Yes.
25% patient new patients, if I tell. new patient incidence means new patients are detected. 25% are detected in India only. Imagine how much prevalence is here in India
Yes,
of
exactly.
this tuberculosis. So what happens? Most of the people are infected with TB.
But
Anyone can be infected, but
yeah,
who would have disease? It depends on the immunity of the
yeah,
body. Immunity depends on your health, and health as it's a state of physical, mental, social well-being.
exactly.
That's why in the lower strata and lower middle income group, it is more prevalent. Though
Hmm.
TB has been seen in upper as well, but more common in lower strata.
Yeah. Sir, I have one more last question to you is if we say that one thing everyone should adhere while having any symptom or just to be healthy, what should that be?
For that, as a respiratory physician, I would say that whosoever has a cough more than 2 weeks
Hmm.
should be investigated in line of tuberculosis. Whosoever has respiratory symptom along with blood and sputum should be investigated in line of tuberculosis.
Yeah,
Whoever has unexplained weight loss, as I said, or a fever which has been for more than 10 days, and patient having weight loss, patient is having cough, and patient has comorbidities like diabetes or patient has immunocompromised condition somewhere should be investigated in line of tuberculosis.
totally got it.
So, and if I talk about the extrapulmonary tuberculosis, if a specific organ is causing disease, I mean a specific organ system is troubling you, your doctor would definitely investigate you in line of tuberculosis. Though if you have eye problem, you go to for the eye checkup, doctor would suspect
Hmm.
because in India, as I said, we are having a great burden of TB
Yes.
or and obviously government is doing fantastic in
Hmm.
this to control the TB, but it's our job as well as a
Yeah,
physician, as a citizen of India. All of us should adhere to that thing which we
exactly.
always want our audience to follow.
Yeah, very well said, sir. So before wrapping up this podcast, sir, we will do a quick segment of truth and myth, so that the people who has something myth in their mind, they can just have the answer from the best from that field. So my first question would be, sir, a chest X-ray, which is one of the traditional method, can alone also confirm TB diagnosis, truth or myth? Okay.
Alone, just actually cannot diagnose. It can help, but cannot diagnose.
Okay.
Always gold standard is sputum culture.
Okay. TB testing always takes several days to produce result. Truth or myth?
Not several days as molecular tests are available now. It takes few hours to detect. So it's myth.
Modern molecular tests can detect TB much faster than the traditional method, and it is more accurate. Truth or myth?
That's true.
That's true.
That's true.
Early diagnosis can significantly reduce the spread of tuberculosis in the community and to that patient as well. Truth or myth?
True. True.
And my last
Absolutely.
question would be, can rapid test done in the home as well? Truth or myth?
With
Myth.
rapid test can be done at home. It has to be done in the specified laboratory.
Because since the COVID, everyone thinks that where the rapid
Yes,
were.
as a rapid antigen, that was a different one. It was epidemic. It was done to get it diagnosed. If it is TB, if it is not, it may be some other infection or some other problem which is causing cough to you or breathlessness or chest pain to you. Your pulmonologist would definitely diagnose it very well.
Thank you so much, sir, for sharing this much information about the traditional diagnosis system and the molecular one, which is the modern one. It has just made us to think more about how advanced the diagnosis system is and how easily can a patient become curable without having much, you can say, any kind of disease in his or her body. So tuberculosis remains a major health challenge, but as we have learned in this conversation, advancements in diagnostic technology are helping doctors detect the disease much earlier and much faster. And the most important takeaway from today's discussion is, if symptoms persist, don't delay in testing. Early diagnosis can make a life-saving difference. Thank you so much for joining MedGate Today TV Digital, and we hope this conversation helps spread awareness about tuberculosis and the importance of timely diagnosis by the best from the field. Thank you so much, sir, for giving us the insights.